I'm Dr. Baby, so I'll be happy to talk to you about puberty today. So I'm just going to share my screen so we can look at the PowerPoint. Right. All right. So today I'd like to discuss how we as families can navigate puberty and its changes together. So what really is puberty? So puberty is a developmental stage during the adolescent period when a child becomes a young adult. And this is due to physical changes or the development of secondary sexual characteristics. So, in males, some changes that we see could be increased facial hair and body hair growth, voice changes as well, including voice deepening. And in females, typically these changes include breast development and then ultimately getting your period. And these physical changes that occur in puberty rely on the release of different hormones, namely testosterone in males and estrogen in females. And with these physical changes, there's also psychosocial changes that happen with puberty as well. So, how does puberty occur? So, in our brain, there is something called the hypothalamus that communicates with our pituitary gland, which releases different hormones. So, the pituitary gland makes LH and FSH, which are hormones that communicate with the testicles in males to release testosterone, and it also communicates with the ovaries and females to release estrogen. And this is what causes the development of those secondary sexual characteristics. The pituitary gland also makes ACTH, which is a different hormone that communicates with the adrenal glands, which sit on top of the kidneys in both males and females. And the adrenal gland makes different hormones, including testosterone as well, interestingly, in both males and females that causes body odor, acne, and pubic hair in both genders. So interestingly, having those signs of body odor and hair growth aren't signs of true puberty in females. It's more that the adrenal glands have activated, whereas true puberty in females relies on the ovaries to make estrogen, and that causes breast development and ultimately getting a period. And puberty is expected to occur in females anywhere between ages 8 to 13 is when we see puberty start, and in males, it starts a little bit later between 9 to 14 years of age. So some of the events that define puberty, so these are some of the medical terms that are used. So thelarchy is breast development. Pubarchy is the onset of pubic hair, which again relies on the adrenal gland. Menarche is getting your first menstrual period. Adrenarche is when the adrenal glands are activated and make different hormones. And then gonadarche is when the ovaries and testicles are releasing estrogen and testosterone, respectively. So this slide provides an overview of the normal progression of puberty in females. So the first sign of true puberty in females is thelarchy, which is breast development, and that could be followed by pubic hair development. There are cases where pubic hair may start before breast development, and that can be normal. But again, that's not a sign of true puberty in females. It's more that the adrenal glands have activated. And then following breast development, girls are expected to have a growth spurt, which occurs before getting their period. And the first period is expected to happen on average about 2 to 3 years after breast development occurs. So this is how physicians divide breast development in different stages to track how puberty is progressing. So there are 5 stages in total. So the first stage is prepubertal, where there's no breast tissue at all. Stage 2 is when there's breast buds, so just breast tissue below the nipple. Stage 3 is when the breast tissue spreads beyond the nipple. And then stage 4 is when the nipple forms what's called a secondary mound, or almost an appearance of a lump on the breast tissue. And then stage 5 is further development into what's more an adult contoured breast. The patriarchy or breast development, again, is the first sign of true puberty in girls. And it can be normal to have uneven breast development, which could even out over time as puberty progresses. With pubic hair, the way physicians evaluate this, there's also 5 stages as well. So stage 1 is when there's no pubic hair at all. Stage 2 is when the pubic hair is more finely pigmented and straight. Stage 3 is when the hair becomes more pigmented and curled. Stage 4 is when the pubic hair forms a triangular shape in the pubic area. And then stage 5 is when that hair spreads beyond the pubic area onto the thighs. So this just looks at a growth velocity curve in females. So a growth spurt relies on different hormones, primarily growth hormone, thyroid hormone, and estrogen as well. The average duration of a growth spurt in females is about 2 to 4 years, and you would expect a growth spurt to occur around the second stage to third stage of breast development. Because girls start puberty earlier than boys, they are expected to have a growth spurt earlier, about 1.5 to 2 years earlier than males. So menarche, or getting your first menstrual period, that occurs about 2 to 3 years after breast development starts. And the average age of getting your first period is about 12 and a half years. And you would expect to get a period when a female is around that fourth stage of breast development. And then this provides an overview of the normal progression of puberty in males. So, the first sign of puberty in males is actually testicular enlargement, and that could be followed by pubic hair. The pubic hair could also happen before the testicular enlargement occurs. And then following that is penile enlargement, and then males are expected to have a growth spurt about 2.5 years after the testicular enlargement starts. So there are also 5 stages of puberty in males, and that's primarily based on their testicular size, in addition to the pubic hair as well. So this is on the right-hand side, this beaded tool is called an orchiometer, and this is how endocrinologists gauge where a male is at in puberty more accurately. So the first 3 beads here, 1, 2, 3, are 1 milliliter to 3 milliliter in size. So that's the first stage of puberty in boys. So those testicular volumes are considered prepubertal. And then once the testicle is 4 milliliters in size, that signifies the start of puberty. So 4 milliliters to about 8 milliliters is the second stage of puberty in males, whereas 10 milliliters to 15 milliliters of testicular size is the third stage. And then once the testicles are 16 milliliters in size, they're at the fourth stage of puberty. And then finally, the last stage is when the testicles are 25 milliliters in size. So, again, because males start puberty later than girls, they are expected to have a growth spurt later than girls, and this on average occurs about 2 years after females have a growth spurt. And the peak growth spurt occurs around that fourth stage of puberty based on the testicular size. So precocious puberty or early puberty is defined as when these changes occur before the age of 8 in girls or when they occur before the age of 9 in boys. And this can pose psychosocial changes as well, which um, can really impact someone if they are developing earlier and, if someone has early puberty, then they potentially can have a premature growth spurt, which can compromise their adult height to be shorter than expected. So early puberty does occur more commonly in girls than in boys. And then delayed puberty is defined as when there's no secondary sexual characteristics in males by the age of 14. So if there's no increase in testicular volume by that age, and in females, it's defined as if there's no breast budding by 13 years of age, or if there's no menstrual period by 15 years of age. So with having these physical changes, there are, of course, psychosocial changes as well. So during puberty, adolescents can question their identity and who they really are. They may seek independence and form stronger relationships with their peers. They also may be more interested in potentially riskier behaviors. There, of course, can be mood changes as well. And during adolescence, teenagers may find what is really important to them and what they value and what they consider to be their set of morals. During puberty, children can be more easily influenced and vulnerable as well. So females, of course, during these physical changes may have some concerns. They may be uncomfortable with having breast development, and because of that, they may prefer to wear more loosely fitted clothes. Um, and I would stress when talking to children about these changes, it's important to really normalize the changes that are happening. So it's normal for them to have breast development, and it may be normal to have uneven breast size. There could be physical discomfort with increasing breast size as well, which could manifest as mild pain, which could be helped by wearing a supportive training bra. Girls may also have concerns about getting their first period as well. And it's important to explain to children that menstruation is a normal biologic process and that prior to getting a period, it is expected to have vaginal discharge. I would also say it could be helpful to prepare children by for getting their first period by having pads at school or an extra pair of underwear. It is expected that periods can be more irregular or unpredictable the first 2 to 3 years after getting the first period. And that can be normal as their body is maturing and acclimating to having a period. It can take time for the period to regulate and become more on a routine, predictable schedule. And girls may question if they're able to partake in physical activities while they have their period. And of course, are are they are not limited by any means from any physical activities while they have their period. Um, Males can also have concerns surrounding these physical changes as well. So they may have experience voice cracking. Boys can also have breast enlargement during puberty, and that's called gynecomastia, which is something that can be normal and it is expected to regress over time. So males can have uneven testicular size, and that could be normal as well. And they could also experience involuntary erections, which can be sensitive and embarrassing for them. But I again would stress that all of these changes are normal and that they're not isolated and experiencing these changes, and that everyone goes through these changes during puberty. Um, so in discussing puberty with kids, I would encourage to be as open as possible in discussing these changes. And again, stressing that puberty is a normal part of growing up. And it may be difficult to discuss sensitive topics, but again, it's easier to discuss things when we are normalizing them. And I would also say, to the best of your ability, to not look uncomfortable or embarrassed while discussing these changes with your children, because then that creating a comfortable environment will also make children feel comfortable too with discussing puberty. Right, and that's all I have.